And new at 5:30, as the Omicron variant fuels a COVID surge across the country, hospitalizations are also on the rise. And while that does lead to concerns, there's also some positive news when it comes to people going into the hospital for COVID. CBS 4's Joan Murray joins us from Holy Cross Hospital in Fort Lauderdale with what local health leaders are seeing. Joan.
Well, good evening, Lauren. Yeah, hospitals are feeling this latest COVID crunch. Holy Cross here has told women who are about to give birth, find another location. However, I checked with a lot of other hospitals in South Florida, and they tell me while there are hundreds more patients coming in, this is not the same situation as last summer. South Florida hospitals feeling the Omicron punch. Holy Cross said they have reached critical staffing levels in labor and delivery and will not be taking anyone about to give birth. But NICU and postpartum units remain open. Down the street, Broward Health said its 4 hospitals are holding steady staff-wise.
We're trying to retain staff as best as we can, and right now I think that we have the staff to continue to take care of patients.
Broward Health is treating about 200 COVID patients. Like most South Florida hospitals, beds are filling up fast. But this variant appears to be less deadly. Omicron is more contagious as it rages in South Florida. Yet patients are spending fewer days laid up, says Baptist Health's Dr. Jose Latch.
Yeah, they usually have fevers, chills, body aches, a little bit of coughing, shortness of breath, a lot of sore throat, believe it or not. We hope that these patients don't get sick or really sick like they did back in the Delta, back in August. So we just kind of we have to do our due diligence and to basically protect ourselves.
That includes kids. A lot more children are going to the ER, but fewer are being hospitalized, said Memorial's Joe DiMaggio's chief medical officer.
A lot more kids are being infected, but overall, they're not as sick as what we saw during the summer. It seems to really be affecting children 2 and under more than other age groups. In fact, the number of patients that have come through our emergency department that have tested positive for COVID that are 2 or less is significantly higher than any other age group.
So South Florida's latest COVID surge goes on, but there is hope on the horizon.
If the numbers are true from places like Scotland and South Africa, as high as this exponential wave is taking us, once it peaks, the downside of that should be a similar slope. So we should get over this as fast as we got into it. I would hope this month we would see a dramatic difference.
And when I talked to Holy Cross, I was told that they do not know exactly when their delivery room may reopen again. As you heard, the larger hospitals here in South Florida seem to be holding their own when it comes to staffing, but they are paying close attention to this variant. And the hope is, again, that we will see a let-up by the end of January. In Fort Lauderdale tonight, Joan Murray, CBS 4 News.
We're all hoping for that. Joan Murray, thank you.